Hello, my people. What a week it's been. What a week it's been. I don't really know where to start. First of all, actually, I do. I want to thank Grimsby Hospital for potentially saving my life over the last sort of 7 or 8 days. After finding out I had sepsis. Urinary sepsis, I believe it was, which was on my notes. There's a lot to say about this, but I'm going to get comfy and maybe get in my pit for a bit. But before I start saying some of the bad stuff and all the other stuff that's coming with it, I just want to say that there was a lot of good that come from Grimsby Hospital. They have done the job. They did it well, the majority of them. And I'm endlessly thankful for that. But there's a lot more to it than just that. So get comfy, get a brew, and I'm going to get in my pit. There we are then. So as I was saying, Grimsby, fucking dog, Rosie Packardin, Grimsby Hospital. Excellent. They've potentially saved my life over the past 7 or 8 days, as I just said. This all started, I don't know, say a week and a half ago, maybe even 2 weeks ago. Said to Becky, I'm getting a few more pains in my side and that and whatnot, and I started struggling to, like, I'd go for a wee before bed, for example, and it took me a really long time to start the flow. As you do, I feel like I really do need a pee, you know, as you do before you go to bed. And you know, I didn't sort of really pay much attention to it, although it was kind of annoying, and yeah, I just sort of brushed it off. So this carried on for a couple of days. No real other difference in pain levels or any other funny feelings. Actually, there was. I'll go into that in a sec. Yeah, there was one specific night that me and Bex was watching telly in bed, and I got up for a pee, and when I come back, she went to me, "It was 6 minutes before you managed to even start anything. What was you doing in there?" And that's where this other sort of, it wasn't a pain, it was more like a feeling came into it. And I said to her, I was just stood there, and it's like I really had to concentrate on what I was doing to even start having a wee. And as I was doing that, I'd shut my eyes or whatever, you know, getting late on whatever time it was, I don't know. And it was like my mind was going into a different place, like I was wobbling and all over the place. I don't know. It was just like for those who smoke cannabis or use cannabis oils, it was very similar to the as it starts working, you start getting high. That funny feeling. For people who don't smoke or haven't used it, you got a couple of pints and you feel a bit, you know, a bit wobbly, like that. Like I said, and okay, this kept going on for a couple of days, and I just didn't think out of it because I don't know. But Becky did say to me, you know, and my mum, look, we need to go to the doctors to see about it. So I was like, oh, okay. By this point, you know, a few days had passed, and I was struggling even more and more to go to have a wee. Never mind opening my bowels, because I've been that blocked up with, you know, cocodamol and morphine and whatever else, you know, for the pains that I have had. That's not very, or wasn't very regular. So yeah, I went to my doctors, me and my mum. Goes straight in and he's talking to me, does all his like obs and bits and bobs, and he puts one of them you know, the little finger things that give you your oxygen level, sorry, and your pulse and that. and my oxygen saturation or level or whatever you want to call it was 86, which is ridiculous. The lowest it wants to be, according to the doctor, was 95. So straight away he said to me, look, this is an urgent emergency. I could call you an ambulance, and this is where deja vu kicks in, because it went, I can ring it, but it could take between 6 to 8 hours. And funny enough, when I first had the pains with this cancer, before we knew it was that, again, when we rang 999, they give us an ETA of 8 hours again. 8 hours for a fucking ambulance. So it was like, we can't sit around for fucking between 6 and 8 hours. You know, my oxygen levels are that low. And he said, my doctor, obviously I can't name him for his personal reasons, said, I have to tell you that, you know, the ambulance is going to be this time, but if you, talking to my mum, if you was to drive me to the hospital, there is a high chance of cardiac arrest. Which was like a smack in the face. I was like, holy fucking shit, I'm in a lot of trouble here. So needless to say, we come straight out of there, went straight down to Grimsby Hospital, where I ended up spending a lot of time, straight into the A&E department, where you know, I went in and told them what's what. They've give them the notes that we got from the doctors, which they seem to just be like, oh, well, take a seat. So we took a seat. I can't remember. I think Becky and my dad ended up turning up as well. I know they was there at some point. I can't remember what happened, but or whatever. In fact, I think we picked Becky up. Either way, yeah. So we were sat in A&E for, I don't know, maybe an hour and a half, which is quite quick for people who know the A&E in Grimsby. That was quite quick, and there was a few people in there. This was a Wednesday or Thursday afternoon, and it's busy. Anyway, so my name gets called, and I go through to this other room. There's 2 nurses in there who straight away put another one of these things on my finger, and say, look, you know, we need to take blood. We need to do a few other bits and bobs that they was farting around with. Stick a fucking cannula in my arm, which ended up staying there the entire fucking time. So they stuck that in. I'm just trying to think. This is probably bits I'm going to miss out, so if I might pause this just while I fucking remember. Yeah, so they took some blood, asked me all sorts of questions. Obviously they know about my diagnosis, and we didn't know anything else of what this thing was, because when I was at the doctor's, they did a urine test, and it come back clear, negative of any infection or anything like that. So it kind of left everyone a bit baffled as for what was coming next. Let me have a little think, because I'm forgetting what happens next. Right, yeah, so after they took my bloods, they took a few other bits and bobs, all my, you know, blood pressure and all that bits and bobs, sent me back out to the waiting room. A little bit more time passed, I can't remember how long it was, it weren't overly long. I got called through to like another sort of room where there was all these cubicles where people are in beds and fucking on oxygen and all that sort of shit. And they put me in observe and treat, something like that, an observe and treat room, which they basically put us in there and left us for a good few hours while there was farting around doing what we was doing. The blood's come back, and at this point it was probably about 8-9 o'clock at night, and I was thinking, fucking hell, I just want to go home. The doctor says to me something about there is an infection. Your infection markers are a sky eye, which normal people's infection markers, this is where it differs, is first off I was told it was between 0 and 10, then I was told anything from 0 to 50 is fine. Mine was 276. which is, according to them, absolutely massive. So yeah, that ruled me as an overnight stay. So Becky sort of plans out for the kids to be looked after and whatever, and he cleared off. The bloke cleared off. I was getting a bit frustrated because I was thinking, oh bloody hell, my dogs, you know, the kids, and I didn't really know what was going on. I was hurting. They put me on oxygen and a few other bits, which you'll see the video that Becky put up in the green. It was like a lime green room. I think it's on his shorts actually. So yeah, he come back again. So this nurse or doctor or whatever it was, and confirmed that I wasn't going home, and it is sepsis. Well, me, my mum, my dad, and Becky all looked at me and went, "It is sepsis, isn't it?" Like, holy fucking shit, you know. I've got sepsis and terminal cancer, stage 4 terminal cancer, multi-organ metastatic or metastasis, whatever you want to call it. And he looked at us and went, yes, it is sepsis. So, fucking hell, not only did that just boggle my head and everyone else's, it left me in a situation of, fucking hell, you know, I don't know a lot about sepsis, but I know it's pretty serious, pretty bad. So, it was a whirlwind. Anyway, me and Becky ended up spending the night in that room. It was fucking awful. They instantly put me on antibiotics or some real strong antibiotic things, whatever it was, I can't remember, through a drip every 8 hours. So the next one that I had in the morning was 6 o'clock in the morning. Every morning that I was there, they would wake me up at 6 o'clock for this fucking thing in my vein, in my arm. So it come to probably about dinner time the next day, and they moved me and Bex, because obviously Becky was staying with me, moved us out of there into IAAU. No, it wasn't. It was another room before IAAU. I think it was like, it's the same sort of ward or area that I ended up spending most of my time on, into a blue room. No, it wasn't. Yeah, it was a blue room. To which I started to spend quite a lot of time sleeping, in pain, and being generally pissed off. Hold on. My phone kept shaking. I don't know what's going on with it. So, oh, fuck off. So yeah, as I was saying, they put me in a room. I was falling asleep and all sorts of stuff quite often. The next thing that I know from being in the blue room, the second room that I was in, was I was being woke up by Becky and this nurse that they wanted to take me out of that room again into another room, and you know the amount of people that was coming in, the hospital couldn't cope with it. Basically, they didn't have enough beds and all this sort of fucking shit. So they ended up putting us in the a light blue coloured room. That was on IAAU. It's a kind of ward thing, like I said, not far from the darker blue one I was just talking about, which is where me and Beck spent the next sort of 5 days. And this is where it gets fucking good, is that although I was not fucking great, you know, I was on oxygen for a long time, raising me saturation from like 86 back up to the standard, which for most people is between 98 and 99. Most people, you know, obviously I know I've got cancer and that, and mine will be a bit lower, but it went straight up to 97 after about 24 hours of having the oxygen on. As soon as I took it off, 10-15 minutes it started coming back down again. I didn't notice. I I didn't notice anything about it. I just knew that my side was really hurting and it was starting to really squeeze and become sore. And again, because it's in the same areas where my main tumour is, I couldn't really tell a difference what it was. But they sent me down for a CT scan. Again, they didn't tell me fucking nothing about it. Just said that you're going for a CT scan. Took more bloods, farted around, doing whatever they're doing, and left me and Bex alone for another sort of 8 hours or 7 hours between the IVs. The drip in my arm, which was a joke because there's certain nurses which I found fucking absolutely disrespectful pieces of shit. If I'm honest with you, you know, I'm probably the most chilled out, relaxed person about a lot of things, but I was like, how can something this serious, you're pandering around like it's nothing. You're all talking in the fucking corridors, sipping fucking cups of tea or coffee or whatever. You know, there's people on buzzers and there's me in here and I'm on fucking oxygen, and it was just an absolute load of fucking shit. It really was. I think the worst part of it was more the four walls and the fact that there was nothing me or Bex or my mum or dad could do other than sit and wait for someone to tell us what's next. So yeah, the second night passes. I've got some night staff on. Again, I can't mention names, but there was a specific woman nurse who come in, and she was absolutely brilliant. You know, she'd pop in, bang on time for my drips and that. If it's something like 10 o'clock at night, and then again, like I said, 6 in the morning, when she was doing hers, she'd pop in. You know, is everything all right? Can I do it for you? This, that, and the other. Actually giving me the figures of my infection rate. Whereas when I asked people before, they go, oh yeah, I'll go get it. You won't fucking see them again for another fucking 5 hours. It's like, it's an absolute joke. Anyway, so yeah, the next day comes around, and again, I go for yet another CT scan. With the contrast, the dye they put in you. I'm thinking, I had one less than 24 hours ago. Why do they want another one? And even to now, I still don't know why they did two. You know, I know they obviously want to see if there's anything obstructing, why I couldn't pee or whatever. But yeah, it's been confirmed that I had sepsis, but yet they're still trying to figure out what's going on, why I couldn't piss. So that made me laugh. And throughout the next couple of days, there was good people and bad people. I'm not going to go into the ins and outs of it because it really is a joke. But it was just so bad that how can someone with an already serious illness or disease come in with another potentially life-threatening illness or disease or infection, should I say, and they just treat it like you've got a fucking cold. Like, wow, it was me fucking putting the oxygen on and taking the oxygen off half the time because no one was there to fucking even check what I was doing. I could have been dead in there and no one even know. Yeah, it was absolutely shocking. The funniest thing with some of these specific nurses that I'm talking about, the ones that I didn't really, there was only 2 or 3 that I didn't really sort of get along with because the rest were all quite nice and polite and whatever and caring. But obviously Becky was with me. You know, she got air dinners with my dinner and that. But yeah, if you ask for a tea or coffee here, meaning Becky, no, you can't have that. You can't have that. Only the patient. So when we questioned it, why some nurses would give us it and some wouldn't, oh, it's in our policy handbook or in our contract or whatever she said, that we can only give drinks to the patient. We can give drinks to people who are staying here if it's end of life. So you're saying that, but yeah, other nurses are just giving it out like you would. Like you would. I mean, is it hurting anyone? We spend enough fucking on your bastard car park. Never mind buying drinks and food from the fucking shop because your fucking dinner's here is shit. I'd rather eat fucking cardboard. Oh, it was just absolutely fucking bollocks. But yeah, to cut a long story short, because my mind is a bit patchy with being asleep and awake and oxygen and fucking shit being pumped into me. I was again told twice that I needed to be moved out of the room that I was now in into some ward, which by the end of it didn't happen. And then I was told I'm being transferred to Hull, not Castle Hill, Queens, Hull Queens or whatever it is, which I was fine with. But what I wasn't fine with was the fact that if they transferred me there, Becky had to stay here in Grimsby, and it'd be just me going on my own. I wasn't happy with that. What if I fucking died? You know, it's a possibility of it. I don't know what the chances will be, but I was like, no, I'm not fucking going on my own. Simple as that. I don't care. To which I had quite a bit of an argument with everyone, including my mum, because she was like, look, you need to go. We need to get the best for you and get you sorted. Which I agree with completely, and even Becky was sort of, look, you know, you've just got to go. No, I'm a stubborn bastard, and I say no, it means fucking no, especially in circumstances like this. So there was an ambulance that turned up for me, funny fucking enough, you know, within an hour or so, but yet they can't get one to me when I'm in dire need of one to take me to Hull. There was another patient apparently that was going down there, which I was going to get a ride with this other person. For a start, I'm wide open to infection. You know, I shouldn't be around other people other than, you know, like obviously Becky if she's staying with me, and or any kind of infection or anything like that. I don't fucking know. I'm not a fucking nurse or doctor. But yeah, I turned it down, and there was like, right, well, we haven't got any beds. You know, that the one on our ward is gone, and you've turned down Hull. We don't know what to do, and literally the nurses and everyone there was like, we don't know what to do. So I spoke to one of the male nurses, quite a nice bloke, can't name him again obviously, but I said, look, I need to speak to someone that can give me the answers, that can say what's next. Which was is it matron or like the higher nurses or whatever the fuck it is. So yeah, this woman come round with another lady and said, look, you know, we can't really do it. You've been referred to Hull, which ultimately, long story short again, was they were referring to me to Hull because that's where my treatment for my cancer is. Not for this new fucking thing, which they're trying to find out what it is. There's been that much miscommunication, no one speaking to each other, that one fucking don't know what the other is. They don't know the fucking arm from the bastard leg. So I was pretty pissed off at that they was trying to fuck me off when all they knew is I've got some kind of issue. It's where my tumour is, but it's not that. I've got some kind of obstruction, and my urine or the pipe coming from my kidney to my bladder, I think it was, is being crushed because my kidney is swollen up, so it was pushing down on it. So obviously that's what was causing the pain. Or so they say. I still don't know to this day. So yeah, by the end of it, they was like, all right, well, we're gonna have to keep you here in this room. I was like, oh, that's fine. No, I don't care. That's what I was gonna do anyway. So again, another night comes past, and certain people I'm asking for the infection rates because each time that I have this intravenous fucking antibiotic thing, whatever it is, the markers were coming down, which, like I said, was from 279 or 270 something, was coming down each time. But when I asked, like, the morning staff, which was the ones at the time that I went having a good time with, they'd just say to me, "Oh, it's coming down." They wouldn't go on the computers, even though it's right next to them in the room with me. It was just absolutely shocking behaviour. Really is shocking behaviour. Yeah, so I stayed in that room again, and sure enough, the night after that, they tried to take me out again. We need to move you to some other bloody ward or whatever it was. I can't remember what it was. There's been that fucking many. And again, I don't know what happened, but they said they'd take me out, and like 3-4 hours later, I'm still sat there, packed all the bags up, waiting for them. Oh no, it's okay, we don't need to now. What the fuck? So again, it just carried on. I see some more quite nice nurses and people who served the dinners up and that and whatnot, and we kind of got to know who was the nice ones and who was the arseholes, if you like, within that area of the hospital. Which leads me up to like the 6th day. The 6th day, because I was released on the 7th day that I was there. They said to me, "Right, now we're going to move you." I was like, "Oh, we fucking go again." "Right, when we're moving to this time?" And they said, A1 ward. I was like, "All right, fucking hell, where's that?" And it's basically fucking like a short stay part, as far as I can work out. So I gets up there, we've got all our fucking bags. I'm sat in a pissing wheelchair because I haven't walked properly for the majority of the time that I was in the hospital. So you could say a good 5 days that I'd been sat, barely walking, using this wheelchair. Goes onto this ward. It absolutely fucking stunk like nappies. Horrible smell. But I was like, it's an hospital. I know there's old people here. People are poorly and whatnot. And I got put in again another like cubicle thing, and this one actually had a fucking shower in. I was amazed because I had to have little sort of strip washes in throughout the stay until this 6th day. 6 days of not having a shower or a bath or whatever. Just strip washes and cleaning bits of myself that I can, and without from Becky and that. And this fucking shit ass room had a shower, which I was buzzing with because I was like, I can just. It was lovely. It was absolutely fucking brilliant. We ended up getting sort of settled down in there. There was another quite nice nurse that sort of popped in and helped out and did my drips and whatnot. And that was that. The 7th day was the day that I was due to be released. The doctor come in early morning, about 10 o'clock. Yeah, we're just gonna take you find some bloods and finalise everything. Make sure you're all right. Your markers are all good now. You're down to like 47, I think it was. No, it was less than that. It was well below, okay in their medical view of it, of the infection. To which they was going to provide me oral tablets to come home with, which I'm on now. So yeah, he come round and he did all his tests and that. My saturation's up to 98 or whatever. I'm off the oxygen. I'm starting to walk about and feel all right, and generally improving a hell of a lot, which I actually didn't notice my decrease until I just couldn't pee one day, and quite lucky that we kind of went to the doctors and sorted it when we did, because if I'd left it any longer I might not have been here. Cancer wouldn't have killed me, it would have been fucking sepsis. But anyway, yeah, so he come round, Yeah, we're gonna have you sorted out, this, blah blah blah. We'll get everything, your plan wrote up. And I thought, oh, nice one, you know. I'll be on by sort of dinner time. I can go see my kids, my dogs, blah blah blah, this, that, the other. No, it didn't fucking work like that, did it? I think by the end of it, it was about 5 o'clock, maybe four, between 4 and 6. Say, I can't remember what time it was. Like, wow, me and my mum and dad, because we're all expecting me to go home, sat in this fucking room for hours on hours, just waiting to be released. And I understand, you know, they've got to take all the precautions and stuff that they can, but I'm like, fucking hell, you're leaving me for hours on end. Even when I press the frigging buzzer thing for a nurse to come in, it takes about fucking 3 hours for you to come in then. And I can hear my bloody buzzer going meh outside my door, and I think it's a flashing light and stuff. Like, what the fucking hell is this hospital come to? You know, I certainly won't be going back there unless I really, really have to. I really, really don't want to go there. And I don't really want to have this again, to be honest with you, so that's why Becky's at a kid's party and I'm at home, because I don't want to have any kind of contact with anyone else. I know my kids are going to be around other people, but at the same time, I can't avoid everything. And this was according to them, a urinary problem, which got infected and obviously ultimately led to sepsis. So it is what it is. I'm out now. I was absolutely fucking buzzing when I got home, seeing my kids, my dogs, and it was brilliant. You know, even now, I'm still having some pretty crap night's sleep, even in my own bed. I thought it'd be a lot better, but the pain's still there, still waking me up, more so than what the actual tumour itself was, the cancer itself, before this was. It's just been a shit show of a fucking week. I can't do it about it, but I'm still here. I'm still fighting. I'm still doing this just to prove to everyone that, you know, I speak to a lot of people. There's one person on my Facebook Messenger, that has said to me, look, I hate this. I mean, my rotten body's it's feeling bloody awful, blah blah blah. And I'm like, I know exactly where you're coming from. I know how it feels. I know, like, I'm laying here now, just getting a bit of rest. This is probably the best I've felt in weeks. And I know how it feels when you're like, your body just can't do anything. Your mind wants to, fucking hell, it wants to, but your body just can't do it. It's awful. It's a horrible feeling, especially when you've got small kids. You know, sunny days outside, and you're fucking awful, like, and just bedridden, stuck. It's awful. It's absolutely horrible. The worst feeling ever. But, you know, I think going through all this, seeing my son and my daughter's face when they come through the gate, and, you know, after being at the nan's for a week, without, I mean, they obviously saw Bex when she'd popped back and whatnot, but they didn't see me. Seeing their faces when they come back just made everything so much easier and better in my own head. Yeah, so it's been a hell of a week, a hell of a week and a half, should I say, whatever. I'm still not out of the woods yet. I feel a hell of a lot better. Fucking hell, I've even been doing work in the garden. You know, you guys know what I'm fucking like. I'm not going to stop. I'll stop when I'm dead. It's as simple as that. Now, I like to think that I'm helping other people, and, you know, I just want to tell everyone that is going through cancer, is going through a shit time, depression, fucking mental health, cancer, fucking sepsis, whatever, you know, keep fighting, you know. There is some light at the end of the tunnel, regardless of where you are. I'm telling you that from basically, I'm a dead man walking. I've been told like twice already that I'm going to be dead within a certain amount of time. Not to mention getting a nasty infection or a deadly infection on top of this thing that's already trying to fucking kill me. It's not nice. No, it's not nice. But you know, what can you do about it? What can you do about it? Fucking hair's growing back a little bit. I think there's some bald patches here and there, but even my nails, like, they're almost grown out. I was told that they would fall out. Another thing that they've potentially got wrong, I'm not a statistic. I'm a person that's different, or maybe built different to others that I've seen. So yeah, that in a nutshell is a very much shortened down version of how the fucking hell it's been for the past however long. Absolutely crazy. I tell you what, without Becky, my mum, my dad, Becky's mum, Dave and that, and it wouldn't have been the same outcome. It wouldn't have been the same outcome at all. It's gone as smooth as it possibly can, and I'm very, very happy to be home. Not out of the woods. I've got a little bit of pain now, but I can deal with it. As for the oromorph that I was taking, because I weren't measuring it, and when I was in hospital, they was giving me in a syringe. I noticed that I might have been taking a bit too much. Whereas if I'm in pain, I just have a quick swig, and it was normally like 2 or 3 swallows. Whereas the ones that they was giving me in the hospital, which was measured out, was like not even half a swallow. So I was thinking, maybe fucking hell, all the times that my head's been a bit wavy and I'm feeling a bit dozy. It's all the morphine that's been pumped into my body. I shouldn't let it off because that could well be potentially dangerous as well. But it is what it is. It is what it is. I live to see another fucking day. So I might try and put some pictures and bits and bobs in after this of what I've got. I don't think there's many because it's been pretty dark and shitty week or so. But I'm on the up again. I'm on the up, certainly on the up. So that's that. Terminal cancer and sepsis. What a fucking load of shit. I don't rate it. I don't rate it at all. Anyway, peeps, I've been talking for a while now, so I'm going to get off, bang the telly on, have maybe an hour to myself just to chill out before the kids come back, and back at it. Fucking back at it. I'm sure there'll be a video coming again soon, as long as I still feel this well. Keeping you all updated with the progress and Luke's fucking army. I won't be defeated, you won't be defeated, just fucking smash it. Just smash it. I know it's easier said than done, because I've done it as well. I'm doing it. I'm going through it. So, I know a lot of other people that are as well. Anyway, it is what it is, people. If you want to talk to me one-on-one, if you want to have a chat with me, feel free to find me on Facebook, Messenger, fucking Instagram, any platform you can find me on. Give me a chance to reply, because sometimes it does take me a little while. But yeah, open to everyone. Luke's Army. We're going to